Welcome to the Beginner Dermal Filler course. This is Dr. J. Park with Cosmetic Medical Training. This is a shortened version of our paid online course. The paid online course is much more detailed and goes over the following: the history of dermal fillers, the differences of hyaluronic acid dermal fillers, warnings, precautions, consultation steps, injection techniques. We'll go over how to inject areas such as nasolabial folds, oral commissure, mental, lip augmentation, perioral injections. So let's get started. Hyaluronic acid. As a principal polysaccharide in the extracellular matrix, hyaluronic acid is instrumental in maintaining skin elasticity and fullness. Age-associated HA loss results in skin laxity and volume deficit. Cross-linked HA forms the basis of most contemporary dermal fillers, which are predominantly produced by gram-positive bacteria. This innovative development has led to the creation of non-animal source hyaluronic acid. Cross-linked HA is characterized by its remarkable versatility, facilitating the customization of its physical properties such as hardness, lift, duration of survival, and resistance to heat and degrading enzymes. It is a stable, cost-effective, safe, tissue-compatible biomaterial. Furthermore, HA's tissue residency is significantly prolonged due to its cross-linking. G' is a measure of the viscosity and elasticity of a dermal filler. It is a dimensionless quantity that is calculated using the following formula: G' equals shear stress divided by shear rate. Shear stress is the force that is applied to the filler to make it flow. Shear rate is the rate at which the filler flows. A higher G' value indicates a more viscous and elastic filler. This means that the filler will be more difficult to inject and will more likely to hold its shape once it is injected. G' is an important factor to consider when choosing a dermal filler. The G' value will affect the way the filler flows and how it holds its shape. For example, a filler with high G' would be most suitable for volumizing and lifting, while a filler with low G' value would be more suitable for filling fine lines and wrinkles. The G' value for dermal fillers vary depending on the type of filler and the brand. In general, hyaluronic acid-based dermal fillers have a lower G' than calcium hydroxyapatite-based dermal fillers. The G' value of a dermal filler can affect the results of injections in a number of ways. For example, a filler with high G' value will be more difficult to inject and may cause more pain. Conversely, a filler with low G' value will be easier to inject and may cause less pain. A filler with high G' value will be more likely to hold its shape, which can lead to longer results. Conversely, a filler with low G' value will be less likely to hold its shape, which can lead to more temporary results. Restylane is a comprehensive line of hyaluronic acid-based dermal fillers developed by Galderma, each with its unique properties to address different cosmetic concerns. Understanding these differences allows you to choose the most appropriate product for each patient's unique needs. Below is a comparative exploration of Restylane products: Restylane, Restylane L, Silk, Lift, Refine, Define, Kiss, Contour, and Highlight. Restylane is the flagship product with 20 milligrams per ml HA and a moderate G'. It's versatile, suitable for moderate to severe wrinkles, facial contouring, and lip enhancement. The moderate particle size provides both lifting and smoothing properties. Restylane L is similar to the original Restylane, but includes the 0.3% lidocaine, a local anesthetic for improved patient comfort during the injection. The inclusion of lidocaine doesn't alter the HA concentration or the G'. Restylane still contains smaller, smoother particles around 500 microns than its counterparts, making it perfect for subtle lip augmentation, smoothing fine lines, especially around the mouth. It has a 20 milligrams per ml HA, but a lower G prime due to its smoother consistency. Restylane Lift, formerly known as Perlane, has larger gel particles and a higher G prime, offering more substantial volumizing and lifting capacity. It's excellent for enhancing cheeks and correcting volume loss in the midface. HA concentration is 20 milligrams per ml. Restylane Refine uses expression technology. Refine has a flexible gel consistency providing subtle correction of laugh lines while maintaining natural expression. It has 20 milligrams per ml HA, but the G prime varies due to the cross-linking process, enhancing flexibility. Restylane Define also uses the expression technology. Define has more cross-linking than Refine, offering more support for deeper laugh lines while still allowing natural facial movement. It also contains 20 milligrams per ml HA. Restylane Kiss is tailored for lip augmentation and smoothing of upper perioral lines. Kiss also uses the expression technology for flexibility and naturalness. It has 20 milligrams per ml of HA, but its unique cross-linking gives it a different G prime, ensuring longevity and a softer feel. Contour is designed specifically for the cheek and chin augmentation. It uses the novel cross-linking method of the expression technology, creating a product with variable G prime allowing for excellent lift and longevity. It also has 20 milligrams per ml of HA. Restylane Eyelight is a specific filler designed for tear trough with a lower HA concentration of 15 milligrams per ml and lower G prime. Its softer gel consistency is ideal for delicate areas like under the eyes. It also contains lidocaine for added comfort during the injection. Each Restylane product is tailored for different needs with variations in HA concentration, G prime, particle size, and the presence of lidocaine. Some newer products leverage the expression technology for different cross-linking levels, affecting their consistency and allowing for more natural look while maintaining volume and lift. Knowledge of these will enable you to optimize the treatment outcomes. The Juvederm range of dermal fillers developed by Allergan is well regarded for its specialized products, each addressing different aesthetic needs. A deep understanding of their individual characteristics enables you to select the best suited filler for the patient. The discussion below explores Juvederm Ultra, Ultra XC, Ultra Plus XC, Voluma, Volbella, Volure, Volux, and SkinVive. Juvederm Ultra with 24 milligrams per ml of HA Ultra provides versatility in treating moderate to severe wrinkles and folds, particularly the nasolabial fold. Its moderate G prime and hyalocross technology, which provides high degree of cross-linking, offers a balance between volume and spreadability. Juvederm Ultra XC, like Ultra XC offers 24 milligrams per ml of HA, the same degree of cross-linking. The difference lies in the inclusion of the 0.3% lidocaine intended to increase patient comfort during and after injection. Juvederm Ultra Plus XC has a higher G prime than Ultra and Ultra XC due to more robust cross-linking process, resulting in more substantial lift and higher viscosity. It's ideal for addressing more severe wrinkles and folds. Juvederm Voluma is tailored for the deep injection into the cheeks to correct age-related volume loss. It has a high G prime due to proprietary Vicross technology, which involves cross-linking low and high molecular weight HA and offers 20 milligrams per ml of HA. Juvederm Volbella is designed for lip augmentation and correction of the perioral lines. It uses the Vicross technology and has a low concentration, 15 milligrams per ml, and a lower G prime for smooth consistency suitable for delicate areas. Juvederm Volure uses the Vicross technology and offers an HA concentration of 17.5 milligrams per ml, The moderate G prime makes it an excellent option for moderate to severe facial wrinkles and folds. Juvederm Volux, designed for the lower face. Volux is used to sculpt chin and jawline. It uses the Vicross technology and has a high G prime and an HA concentration of 25 milligrams per ml, ensuring longevity and a significant lift. Juvederm Skin Vive is designed for superficial dermal injections to improve skin quality, texture, and elasticity. Its HA concentration is lower. In summary, difference among the Juvederm filler range from variation in HA concentration, G prime, inclusion of lidocaine, to the use of proprietary technology like Hyaluronic and Belotero. The specific characteristics of each product is designed to optimize outcome for different cosmetic needs, and a detailed understanding of these is beneficial to treating your patients. Developed by Teoxin Laboratories, Resilient Hyaluronic Acid, or RHA, fillers are the first dermal fillers designed for dynamic areas of the face, adapting and stretching to work with facial movements. The family consists of RHA Redensity, RHA2, RHA3, and 4. The specific details and key differences are explored below. RHA Redensity has a concentration of 15 milligrams per ml. Its low G prime makes it ideal for injection into the dermis and superficial dermis of the face for the correction of moderate to severe dynamic perioral rhytids in adults aged 22 years or older. RHA2 has an HA concentration of 23 milligrams per ml and is intended to fill moderate facial wrinkles. It has a moderate G prime, allowing it to balance between firmness and flexibility. The HA in RHA2 is cross-linked, which increases its viscosity and longevity. RHA3 also has an HA concentration of 23 milligrams per ml, but has a higher G prime than RHA2, making it firmer and more suitable for filling severe facial wrinkles and folds, such as nasolabial folds. RHA4 also has 23 milligrams per ml and has the highest G prime in the RHA series and is tailored for correction of severe wrinkles and facial contours, typically used for volumizing areas such as cheeks or jawlines. A key feature of the RHA series is its preserved network technology. Unlike other fillers that can lose their structural integrity upon injection, the RHA series preserves a native HA structure, resulting in a more natural look and feel. The Versa line of hyaluronic acid-based dermal fillers are each known for their unique manufacturing processes and properties. Versa, manufactured by Perlenium, is a homogeneous monophasic dermal filler that contains 24 milligrams per ml of HA. The product is created using a proprietary wet milling technology, which produces spherical and uniform particles. These particles result in high-quality HA, reducing inflammation and longevity. Versa has a relatively high G prime, giving it a good lifting capacity. Versa Plus is also part of the same Perlenium portfolio. It's similar to the original Versa, but includes lidocaine for enhanced patient comfort during the procedure. Lips Plus is specifically designed for lip augmentation. Lips Plus is another Perlenium product with 24 milligrams per ml of HA. Here we'll explore the specific details and key differences between Belotero Balance and Belotero Balance Plus. Belotero Balance is manufactured by Merz Aesthetics. Belotero Balance is unique due to its cohesive polydensified matrix technology, which produces a smooth, flexible gel. Belotero Balance has a 22.5 milligrams per ml HA and a moderate G prime that offers balance between lift and spread. This filler is suitable for moderate lines and wrinkles. Belotero Balance Plus is similar to Belotero Balance but contains 0.3% lidocaine to reduce pain on injection. Combined list of contraindications. Dermal fillers are contraindicated for patients with severe allergies manifested by a history of anaphylaxis or history or presence of multiple severe allergies. Dermal fillers, which contain trace amounts of gram-positive bacterial proteins, are contraindicated for patients with a history of allergy to such material. Dermal fillers should not be used in patients with previous hypersensitivity to local anesthetics of the amide type, such as lidocaine. Dermal fillers should not be used in patients with bleeding disorders. Dermal fillers are contraindicated for use by anyone with skin infection or a susceptibility to keloid formation or hypertrophic scarring. Dermal fillers should not be used by pregnant women or nursing mothers. Patients under the age of 22 should not be treated with certain types of dermal fillers. Patients with evidence of scars at the intended treatment site should not be treated with dermal fillers. Patients with acne or other inflammatory disease of the skin should not be treated with dermal fillers. Patients with unattainable expectations should not be treated with dermal fillers. Dermal fillers should not be used in patients who have plans to undergo desensitization therapy. Dermal fillers should not be used in patients with acute or chronic skin disease in or near the injection sites or with any infection or unhealed wounds of the face. Patients under anticoagulant therapy, antiplatelet therapy, or with a history of coagulation defects or connective tissue disorder should not use dermal fillers. Dermal fillers are not intended for intravascular use and must not be injected into blood vessels, as implantation into dermal vessels may cause vascular occlusion, infarction, or embolic phenomena. Dermal fillers should not be used in conjunction with laser, IPL, chemical peeling, dermabrasion treatment, or with over-the-counter wrinkle products or prescription wrinkle treatments within 4 weeks prior to treatment. Please note that this list is a combination of all contraindications from each product, and each individual product may not have every listed contraindication. Always refer to the specific product's package insert. This is a combined list of all the specific warnings. Avoid injecting dermal fillers directly into blood vessels, as this may cause a vessel occlusion, embolization, or infarction. Rare but serious adverse events associated with the intravascular injections of soft tissue fillers in the face have been reported to include temporary and permanent vision impairment, blindness, cerebral ischemia, or cerebral hemorrhage, leading to stroke, skin necrosis, and damage to underlying facial structures. Use of these products on patients who are pregnant, breastfeeding, or under age 18 years old have not been studied and therefore not recommended. The safety and effectiveness of these products for the treatment of areas other than those specified in the respective FDA-approved labeling have not been established. Do not overcorrect or overfill a contour deficiency because the depression should gradually improve as the treatment continues. Do not mix these products with any other products before implantation. As with all skin injection procedures, there is a risk of infection. Injections greater than 1.5 ml per lip, upper or lower, per treatment session significantly increases the occurrence of a severity of lip swelling. Dermal fillers should not be used in areas that have high vascularity, as there is a risk of vascular embolization. Injection site reactions such as redness, temporary swelling, tenderness, and pain have been observed and are short-term in duration, less than 7 days. Any reaction in excess of this anticipated reaction should be reported to their healthcare professional. This product should only be used by healthcare practitioners who have appropriate training, experience, and knowledgeable about the anatomy at and around the site of injection. Patients with adverse inflammatory reactions that persist more than 1 week should report this immediately to their physician. Healthcare practitioners are encouraged to discuss all potential risk of soft tissue injection with the patient prior to treatment. Ensure that the patient are aware of signs and symptoms of potential complications. Serious adverse events have been reported related to the use of dermal fillers in the areas of the eye. Localized superficial necrosis, scarring may occur after injection in or near vessel, such as the lip, nose, and glabellar area. It is thought to result from injury, obstruction, or compromise of blood vessels. Delayed onset inflammatory papules have been reported following the use of dermal fillers. Inflammatory papules that may occur rarely should be considered and treated as a soft tissue infection. These warnings provide important information for safe and effective use of dermal fillers and should be carefully considered by healthcare providers and patients alike. It is essential to reach out to respective product manufacturers or healthcare providers for additional information. Precaution: dermal fillers are intended for single use only. They should not be sterilized or used if the package is open, damaged, or past its expiration date. The product should be used with caution in patients undergoing immunosuppressive therapy or patients who are using substances that reduce coagulation. The injection of dermal fillers into patients with history of herpetic eruptions may lead to reactivation of the herpes. The patient should be informed that they should minimize exposure of the treated area to excessive sun or heat, UV lamp exposure, saunas, and extreme cold weather until any initial swelling and redness has resolved and puncture site have healed. Any syringe that shows signs of content separation or appears cloudy should not be used. If nodule or persistent papules occur, consider appropriate treatment such as hyaluronidase injection or surgical removal. Prior to treatment, patients should avoid taking aspirin, NSAIDs, St. John's wort, or high-dose vitamin E supplements, as these agents may increase bruising and bleeding at the injection site. Injection: dermal filler injections require a meticulous technique to achieve optimal results and minimize complications. Always insert the needle into the mid to deep dermis for appropriate product placement. You can gently stretch the skin to aid the needle insertion, which can also help visualize the treatment area better. The contour of the needle should be barely visible or not at all, depending on the type of filler used and the severity of the wrinkle being treated. If utilizing a threading technique, apply even pressure on the syringe plunger while slowly retracting the needle. Ensure you stop the injection before completely removing the needle to prevent the product from oozing out. Superficial injection can cause a bluish hue on the skin due to the Tyndall effect. If this occurs, consider massaging the product deeper into the tissue, expressing it out, or dissolving with hyaluronidase. In the fanning technique, keep the needle inside the skin while angling the syringe and reinserting the needle to the hub. Be aware of potential for intravascular injection. If blanching occurs, immediately stop injecting, massage the area until normal skin color returns. Throughout the procedure, you should always feel the resistance of the dermis, indicating the correct plane of injection. If you encounter too much or too little resistance, you may be in the wrong plane. At the end of the treatment, the injected wrinkle should be visibly lifted and filled. The level of resistance that you may feel depending on the area that you are injecting. Injection in the periosteal space may have very little resistance versus injecting into the dermis space. Post-injection: after administering the dermal filler, a careful evaluation is critical to ensure an optimal result. The treated area should feel smooth with no detectable empty spaces or lumps. Strive for a precise correction, neither under nor over corrected. Gently massage the injection site to blend the product with the surrounding tissue. If you feel any bumps or lumps, massage them until they flatten. In most cases, any protrusions will resolve naturally, but reassure the patient and schedule a follow-up appointment within a week. If a lump persists at this follow-up, consider using hyaluronidase to dissolve the filler. Symmetry assessment immediately post-injections can be challenging due to localized swelling and bruising. Invite the patient back after a week for reevaluation once the swelling has subsided. Lastly, any post-injection swelling or internal bruising should resolve in a few days. To minimize these side effects, provide your patient with an ice pack, which can also help to reduce potential bleeding. Injection technique. The success of dermal fillers is not only dependent on the type of product used, but also on the injection technique. There are various injection techniques, each with its own set of advantages and potential pitfalls. Serial puncture. The serial puncture technique involves multiple closely spaced injections along a wrinkle. The key to this technique is the precise placement of the filler. If the filler is not accurately placed, gaps may be found between the injection sites. This technique is less desirable due to multiple puncture wounds it generates. However, it can be effective for treating fine lines and wrinkles, provided that the practitioner has a steady hand and a keen eye for detail. Linear threading. Linear threading is a technique where the needle is fully inserted into the wrinkle up to the hub, and the product is injected along the tract as the needle is gradually withdrawn. This technique requires continual pressure and even distribution of the product. This requires a certain level of skill and dexterity, as practitioners must simultaneously push the plunger of the syringe while pulling back the syringe from the skin. It is crucial to stop the injection several millimeters before completely removing the needle from the skin to avoid superficial placement or leakage of the product above the skin. Some practitioners prefer the push-ahead technique, where the product is injected as the needle is being advanced through the skin. With practice, this technique can be mastered and can provide a smooth, even distribution of the filler. Cross-hatching. Cross-hatching is a technique that involves injecting a series of parallel linear threads at 5 to 10 millimeters apart, followed by a perpendicular series of parallel linear threads at the same distance. This creates a grid-like pattern and is particularly useful for adding volume to a larger area or when multiple wrinkles are close in proximity. The cross-hatching technique allows for a more uniform distribution of the filler, resulting in a more natural-looking result. Fanning. The fanning technique involves puncturing the epidermis once, as in the linear threading technique, and before the needle is completely removed from the skin, the needle is moved in a fan-like pattern to create a triangular shape. Additional, evenly spaced fanning injections may be performed without removing the needle from the skin, depending on the size of the triangular area to be filled. Care must be taken to avoid over-injecting at the proximal end of each fan, as this can result in an overlap of product in one region. Ferning. Ferning or fencing is a technique that involves short linear threading perpendicular to the fold, followed by advancing a few millimeters away from the fold in either direction. This technique is typically used on dynamic facial lines that require stiffness of the skin on either side of the wrinkle. The ferning technique can provide a more structured support to the skin, helping to smooth out dynamic lines and wrinkles. Nasolabial folds. The nasolabial fold is a noticeable line or crease that extends from the lateral borders of the nostril to the corner of the mouth, a signifier of facial aging. The formation of the nasolabial fold occurs due to several anatomical changes with age, such as the gradual medial and inferior movement of the malar fat pad caused by collagen loss and diminished skin elasticity. A heavy mid-face, as seen with aging or obesity, might amplify the depth of these lines. For the provider, it's essential to understand the intricate anatomy of the nasolabial fold area. It consists of 5 layers: skin, subcutaneous fat, superficial musculo-aponeurotic system, facial muscles, and the periosteum of the maxilla. The vascular structure around this area include the facial artery, angular artery, and infraorbital artery. As the facial artery runs near the nasolabial fold, always aspirate before injecting to avoid intravascular injection and subsequent complications. When treating nasolabial folds, the choice of dermal filler is critical. Older patients with deeper folds might need a higher G' filler. G' refers to the elasticity or firmness of a filler. Higher G' fillers can create lift and sustain their form under pressure, which is beneficial in the areas where a more substantial correction is required. Injection technique varies depending on the fold's depth. For shallow and medium folds, linear threading with fanning is typically used. This involves a retrograde injection technique wherein the needle is inserted at the lower part of the nasolabial fold and advanced superiorly towards the nose depositing 0.05 to zero point 0.1 ml of the filler per injection. Fanning, a technique where injections are administered in a starburst or radial pattern, is particularly useful at the upper Y-shaped area beneath the nares and the lateral area to the ala. However, when progressing inferiorly towards the oral commissure, the correction duration tends to decrease due to increased muscular activity. Also, the correction here may be challenging due to the lack of underlying bone and the gravitational effect on the cheek tissue. Following the injection, the provider should mold the filler to ensure optimal distribution and smoothness. This is accomplished by placing a gloved thumb on top of the treated fold and 1 or 2 fingers inside the mouth, then gently molding along the injection site to check for nodules or lumps. HA fillers are particularly amenable to molding due to their malleability. However, while treating the nasolabial folds, multiple superficial lines lateral to the folds might tempt an injector. These lines are often a result of dynamic facial expression and should be addressed cautiously, as treating these might lead to a visible filler implantation during facial movement, which may appear like cord-like structures on the face. Post-procedural monitoring is crucial, and patients should be educated about potential complications such as swelling, redness, pain, bruising, lumps, skin necrosis, and even rarer complications like blindness due to accidental intra-arterial injection. Additionally, patients should avoid vigorous physical activities, exposure to intense heat or cold, and alcohol for the first 24 hours post-procedure to minimize risk and enhance recovery. Remember, while hyaluronic acid fillers provide an effective, minimally invasive approach to correcting the nasolabial folds, patient safety and aesthetic results should always be the primary concern. Therefore, a thorough understanding of the facial anatomy, injection techniques, and product characteristics are prerequisites to performing these procedures safely and effectively. Lip augmentation, the art of balance and precision. The lips reaching their peak volume by the mid-30s represent a hallmark of beauty and youthfulness. However, with age, features such as the vermilion border, vitreal ridge, and Cupid's bow undergo changes including thinning, drooping, and flattening. The upper lip often becomes thin and elongated, whereas the lower lip thins and rolls inwards. Simultaneously, the orbicularis oris muscle activity contributes to radiating perioral lines, commonly referred to as lipstick lines. Achieving a natural balance augmentation of the lip is a complex task requiring a thorough understanding of facial proportions, anatomy, and the unique characteristics of dermal fillers. When discussing proportions, it's generally accepted that the lower lip should be fuller than the upper lip, with an ideal ratio of 1 to 1.5, according to the Fibonacci sequence. The clinician's approach must be nuanced according to the patient's age. Younger individuals seek to enhance the size and shape, while even small volumes of filler, 0.1 to 0.3 ml, can significantly enhance the lip's appearance. Caution should be exercised to prevent the undesirable duck lip appearance. Older patients, in contrast, generally wish to restore their lips to their previous state rather than increasing size. Such patients may not desire lip eversion or an unnatural appearance and might require adjunctive treatments like laser resurfacing or chemical peels for perioral wrinkling or deep lipstick bleeding. Pain during the procedure can be managed by using HA products containing lidocaine, nerve block, or topical anesthetics. However, if nerve blocks are used, it's crucial to work promptly as a numbing can distort the lip position. In terms of injection techniques, threading is recommended for minimizing puncture sites. The vermilion border and the wet-dry junction are common targets for lip volume enhancement. To increase lip size and provide lift and contour, the needle should be inserted 1 to 2 millimeters from the vermilion border towards the mucosal border, creating a ski jump appearance. However, overfilling near the vermilion border should be avoided to prevent the duck-like appearance. When focusing on volume enhancement, the needle should be inserted 3 to 5 millimeters from the vermilion border near the wet-dry border, which will plump up the lips without everting the edges. For enhancing the vitreal column, the needle should be inserted at the junction of the cupid's bow and the vitreal column, advancing superiorly. Vertical lip line can be managed by direct injection of the lines or along the vermilion border. Care should be taken to use minimal amounts to prevent overcorrection and unnatural bulging. As lips are a focal point of the face, precision is paramount. Overcorrection or asymmetry can be glaringly apparent. In addition, lips' rich vascularity make them prone to complications such as bruising and swelling. It's recommended to apply ice post-procedure to mitigate these immediate side effects and to ensure equal amounts of fillers are administered. Additionally, due to their high G', fillers such as Juvederm, Voluma, or Restylane lifts are generally avoided in lips, favoring softer fillers such as Juvederm Volbella or Restylane Silk to avoid lumpiness and provide a smoother, softer feel. Potential complications include not only the immediate post-treatment swelling and bruising, but also longer-term problems such as lumps, bumps, asymmetry, and more seriously, vascular occlusion. In the case of vascular occlusion, immediate management with hyaluronidase is critical. In conclusion, RHA dermal filler injection in the lips require a deep understanding of the lip anatomy, precise injection techniques, and careful patient selection and counseling. A conservative approach with a focus on balance and proportion can yield the most satisfying and natural results. Hyaluronidase is an enzyme that hydrolyzes and breaks down hyaluronic acid, facilitating the successful elimination of unwanted HA implantation. It's been utilized effectively to correct asymmetry, overcorrection, Tyndall effect, and vascular occlusion. Hyaluronidase dissolves the filler and reduces edema, thereby helping to minimize occluded vessel pressure. For use, hyaluronidase is eluted with saline in a 1:1 ratio. Mandatory skin testing involves injecting 3 to 5 units intradermally. A wheal formation within 5 minutes, persisting for 20 to 30 minutes with localized itching, indicates a positive skin test. A total of 10 to 30 units should be injected per 2 by 2 centimeter area of impending necrosis. It's crucial to check the package insert for any hyaluronidase product for complete instructions and information regarding warnings and contraindications. Attempts should be made to dissolve or eliminate the injected product. In the case of hyaluronic acid-based fillers, hyaluronidase should be injected all over the affected area, flooding the area with hyaluronidase as soon as possible and a dose applicable to the product to be reversed. For example, 10 to 20 units per injection point. Hyaluronidase injection should be repeated on a daily basis where appropriate and continued for at least 4 days as long as there are signs of ischemia. An anticoagulant such as low molecular weight heparin, aspirin, or Plavix could also be prescribed to increase blood flow to the wound. Other authors have suggested the use of Viagra to dilate the compromised vasculature. This is Dr. J. Park with Cosmetic Medical Training. Thank you for watching or listening. If you have any questions, please contact us at email at cosmeticmedicaltraining.com. Thank you very much.